There are things in life you simply have no control over, other things you have some control over, and there might be a few things that you have a lot of control over. The same applies to the risk of developing frailty. Genetic factors, your age and your gender for example, you have no real control over, which is why they can be considered non-modifiable factors. They are inside a cookie jar that is simply put outside your reach. Chronic conditions and previous injuries you have very limited control over, in the sense that you can cope with them in the best way possible, but that might be it. They might be within reach, but you feel you have to stretch a long way to reach that cookie jar that has these factors. In that same cookie jar, there are also factors that we all like to address, but simply feel we have less control over, such as getting adequate sleep and having good relationship with others, or for example having a responsible use of alcohol and avoiding smoking and drugs. If these factors aren't satisfied, we will not only increase our risk of developing frailty, but these are also factors that contribute to our own well-being. And then there is the nearest cookie jar, with the modifiable factors that you can actually influence yourself. You still have to reach for it and open it yourself, but at least it's doable. In this jar, two of the factors stand out: diet and physical activity. Interestingly, in a particular study, it was reported that of the people identified with a frailty phenotype, almost 80% did so involving the factors unintentional weight loss or exhaustion. And these are closely related to diet and physical activity. That is also the reason that we will focus particularly on these two in the final 2 weeks of this course. But let's dig a little deeper in the assumption that gender and age are non-modifiable factors that increase your risk of developing frailty. This relationship might not be as straightforward as it may seem. For example, as you get older, it is often also noticed that you lose muscle mass. And similarly, females tend to have a lower amount of muscle mass than males. So, if you look at it this way, would the concept of muscle mass not be more important than just age or gender? It could at least suggest that although there is a relationship between age, gender and frailty, it might not be that these two factors cause frailty. Instead, these factors could be related to frailty because muscle mass is the causation of frailty. Although this might appear speculative, the shift in thinking this perspective could induce is that age and gender are things you can't do anything about, but muscle mass is something you can influence, for example via your lifestyle. And that means you can help prevent frailty, almost despite the fact that you might be an older female. As already indicated, some factors are out of reach. Aging affects everyone as they get older. Although there are large variations in the rate at which this occurs, there are some genuine observations that can be made. This is because frailty is a form of accelerated aging. And in the next week, we will dig a little bit more into the natural process of aging. We will dig a little deeper into the changes that are happening in our body with our physiology and our muscles, and our psychology and our behaviors, to find out more about why frailty could develop.